Okay, the next disorder we have here Alkaptonuria. Okay, so Alkaptonuria from the words of alkali. So this is alkali Alkaptonuria. Alkali lover. So basically this is a disorder characterized here by the darkening of the urine, or the urine become black here upon oxidation to the air in an alkali pH. So, unlike in your melanoria natin, upon voiding a urine, it's already, freshly voided na urine is black already or brown. Ito naman, magiging black or brown lang ang urine natin upon oxidation to the air in the presence or in an alkaline pH. The problem with your alkaptonuria still belongs to your phenylalanine tyrosine metabolic pathways. The problem with that, you don't have the enzyme homogenesic acid oxidase. Homogenesic acid oxidase is the enzyme that converts your homogenesic acid to your next product, which is your mallyl acetoacetate. So therefore, since wala kang homogenesic acid oxidase, ang nangyayari ay ang ating homogenesic acid ay hindi nako-convert to your next na product. And therefore, it's try to accumulate in your blood, increasing its concentration. The problem with the homogenesic acid, once it try to accumulate in the blood, it could, pag dumami yung concentration sa blood, it could go deposit to your tissues, including your ears. It could also deposit in our cartilages and your joints, and you were going to have a manifestation of arthritis. Or later on, the patient will develop here a liver disease and a kidney disease as well. Okay, for the laboratory test for diagnosis of your alkaptonuria, so we have the ferric chloride test, characterized here by the transient green na color, the reaction or solution. Then you could also have your Clini test. Clini test, again, is a test for your reducing substances. And your homogenesic acid is a reducing substance. And therefore, magpapositive siya sa Clini test natin. Okay, the next one, we have here your branch chain amino acid disorders. Okay, your branch chain amino acid disorders basically includes your MSUD, your maple syrup urine disease, plus your organic acidemias. For the organic acidemias, includes our number 1, isobaric acidemia, plus your propionic and your methyl malonic acidemia. Okay, they are being called here as your branch chain amino acids because those are the amino acids where they try to branch out through their methyl group. Methyl group is your CH3. So, from the CH3, from their aliphatic carbon, doon sila nagpa-branch. Kaya tinawag silang branch chain amino acid. Okay, the first one, we have your maple syrup urine disease. So the maple syrup urine disease here characterized by the problem in your 3 amino acids. Number 1, your leucine, isoleucine, and the second one, leucine, isoleucine, and your valine. Okay, we have here the MSUD, which is one of your branch chain amino acid disorders. So MSUD would be the problem in the three amino acids. Leucine, isoleucine, or valine, or simply your LIV. Okay, normally those 3 amino acids, normally ang kanilang metabolic pathways involved here, their transamination. Pag nag-undergo ng transamination, itong 3 amino acid, it would produce here alpha-keto acids. The alpha-keto acids includes the following: alpha-keto isocaproic, alpha-keto isovaleric, and alpha-keto beta-methyl valeric acid. The next pathway, it undergo decarboxylation process. Para mag-undergo siya ng decarboxylation process, you are needing the enzyme alpha-keto acid decarboxylase. Ang problem with the MSUD, wala silang enzyme na alpha-keto acid decarboxylase. Since wala silang enzyme na alpha-keto acid decarboxylase, ang mga alpha-keto acid, yung mga ito, nag-accumulate sa blood ni patient. Kasi wala kang enzyme na ito. Ito yung defective na enzyme. Wala silang ganyan. Okay, and therefore, that results to your maple syrup urine disease. Your MSUD, maple syrup urine disease, would be characterized here by the MSUD, maple syrup urine odor. Screening test for that, then you could have your dinitrophenylhydrazine test. So, positive result for that would be the yellow turbidity. Okay, now we go to your organic acidemias. Okay, your organic acidemia also, okay, again, also belongs to your branched chain amino acid disorders. And there are three alpha keto acids. There are three organic acidemias, the disorders. Number one, you have isovaleric acidemia. Then we have your methylmalonic and your propionic acidemia. Okay, in the case of your organic acidemia, most likely the patient would, number one, meron silang ketonuria. Second one, meron siyang hypoglycemia. Then meron silang metabolic acidosis. And the fourth one, increased ammonia concentration. Okay, first we have here your isovaleric acidemia. Okay, we have here your isovaleric acidemia, which is one of your organic acidemia. Okay, so isovaleric acidemia characterized by deficiency of the enzyme isovaleric glycine CoA, isovaleric CoA, and characterized by accumulation of your isovaleric glycine. And the patient would have a characteristic na sweaty feet odor. Another one na organic acidemia, okay, we have that. Okay, we have your propionic acid and your methylmalonic acidemia. Your propionic acid is just intermediate lang siya sa methylmalonic acid natin. Parang nadadamay lang siya. Okay, this is characterized here by the problem related to your metabolism of your succinyl-CoA, which involves here problem related to the metabolism of the enzyme, of the proteins, amino acid. We have your valine, isoleucine, threonine, and your methionine. Screening test for that, we have your p-nitroaniline test that will only give positive result here for your methylmalonic acidemia. Okay, the next one, we have here your tryptophan disorder. Okay, the next, we have here your tryptophan disorder. So basically, for the metabolism of your tryptophan, so normally the tryptophan is metabolized in our intestinal tract by the action of your intestinal bacteria. And therefore, that will be converted to your indole. And if this indole here will be already produced in your intestinal tract, that will be removed in our body by passing through your feces. However, there are sometimes na nagkaroon tayo ng problems sa tryptophan. One here, indicanuria, the other one is your 5-hydroxy indolacetic acid. So first, we'll be discussing your indicanuria. Okay, what happened here in your indicanuria? So basically, this is the normal metabolic pathway. Tryptophan go to your intestinal tract, acted upon by bacteria. But in your indicanuria, may problem tayo sa intestinal tract, like the presence of bacteria, malabsorption, heart nap disease, where in your indole, hindi siya ganun ka mabibreakdown. And because of that, hindi siya masyado na-breakdown. This indole here will remain as indole, accumulate in your intestinal tract, dadami siya. Once dadami siya, it will go to your bloodstream. And some of that would go to the liver. Pumunta sa liver, pag pumunta sa liver, that will be converted to your indican. Tapos sa labas sa ihi natin, magiging indigo blue natin. So, that become your indicanuria. Patient with the indicanuria, since blue ito, usually manifested in a baby having a blue diaper syndrome. Kasi para siyang blue stained diaper because of this indigo blue na color ng indican natin. How are you going to correct or manage for your indicanuria? So, if the problem here is ito, abnormal bacteria o malabsorption, we could correct that one. So, iti-treat mo lang patient antibiotic, for example. Pero pag heart nap disease, your heart nap disease is related to your Fanconi syndrome. Fanconi syndrome is generalized tubular defects wherein it could not reabsorb ang substances natin. A major treatment for the heart nap is you give the patient with the niacin. Okay, food supplemented with the niacin could help para ma-manage ang heart nap disease. Okay, the next one, we have here the pathway related to your tryptophan. We have your 5-hydroxyindoleacetic acid. Okay, normally your tryptophan is converted to your, okay, this one, hydroxytryptophan, then you have serotonin. Your tryptophan in your intestinal tract will be acted upon by argintophene cells that will be converting that one to your serotonin. And once you have your serotonin, it will be converted to your 5-hydroxyindoleacetic acid. Okay, your serotonin is once converted by your argintophene cells here from your tryptophan that will be carried to your blood, basically by your platelets. Serotonin is needed for our smooth muscle contraction. But in the case of your argintophene cell tumor, okay, but if the patient would have your argintophene cell tumor, ang mangyayari dyan ay ang tryptophan natin, madami ang mako-convert dito sa serotonin natin. Pag madami mako-convert sa serotonin, madami ka ding 5-hydroxyindoleacetic acid. Okay, we have here to diagnose your 5-hydroxyindoleacetic acid. Normally, you are just excreting a concentration of 2 to 8 milligrams per 24 hours of your 5-hydroxyindoleacetic acid. But in the case of your argintophene cell tumor, you'll be excreting here much of as many as 25 milligrams or more than 25 milligrams per 24 hours. Okay, we could perform determination of your 5-hydroxyindoleacetic acid with your urine as your sample for that. You could collect that one randomly or could also the first morning urine. Precaution here, the following. The following foods, banana, pineapple, tomatoes, are actually very rich in your serotonin. So if the patient eat that one before the urine collection, expect to have a false positive result. Another one, then drugs here like thiazide and acetanilid should also be avoided 72 hours prior to the urine collection because again, this one is also rich in your serotonin. And therefore, it will result also to your false positive result.